And I'd like to start by moving the motion in my name. Colleagues, I very much welcome the opportunity this evening to talk about the issues raised around capacity in our healthcare system and one element and knock-on effect of that, which is the unacceptable levels of overcrowding which we're seeing in some hospitals in the public health service. The context matters, and I note the Sinn Féin motion doesn't reference the context at all. Ireland and Europe is dealing with a perfect storm of COVID, of RSV and of flu. We're dealing with an unprecedented level of the combination of all three of those. The best resourced healthcare systems in Europe, the best run healthcare systems in Europe are dealing with various versions of what we're dealing with here in Ireland. And that context is important. This is happening right across Europe, and deputies will be aware that the situation in the 6 counties is very, very serious indeed, and indeed in Britain as well. However, we of course have to focus on our health system and do everything that we can. I have visited emergency departments around the country. I wanted to hear firsthand from patients, from their families and from healthcare workers as to what's being experienced. I've seen the distress. I've spoken with patients and their families and our healthcare workers about the distress in some of our emergency departments, indeed in many of our emergency departments. And I want to acknowledge that what I've seen and what patients have experienced in many hospitals around this country over the past few weeks is simply not acceptable in terms of the time waiting to be treated and the time waiting to be admitted to a bed in the hospital if an admission decision is made. I've also visited hospitals where patients are being seen very quickly. They're being treated very quickly. They're being sent home very quickly. Or if they're being admitted into the hospital, they get into a bed very quickly. Indeed, in Deputy Cullinan's own constituency in Waterford, they've gone over 3 years now without a single patient on a trolley. And I think we need to be very cognizant of those hospitals and those parts of the country where things are clearly working very well. The motion tabled by Sinn Féin calls for an urgent expansion in capacity in our public health service, more beds, clinicians, home care packages. What the Sinn Féin motion fails to acknowledge in any way is that we're already in the middle of an unprecedented expansion in capacity in our public health service. Over the last 3 years, we've added nearly 1,000 hospital beds, over 360 community beds. We've a 25% increase in critical care beds. It's an unprecedented expansion in public beds across Ireland. We've hired more than 17,000 extra healthcare professionals since 2020, more than 5,000 nurses and midwives, nearly 3,000 additional health and social care professionals, 1,800 doctors and dentists. In fact, 2020, 21 and 22 were the 3 record years of net recruitment into the HSE since its foundation, and this year is going to be the 4th in a row. The past 4 years will have the highest recruitment, including this year, into the HSE ever. Do I want to go further and faster? Does everybody here? Yes. But let's acknowledge that in the middle of COVID, the HSE has hired at a level that has never before been seen. Now, our emergency departments depend on highly skilled and experienced staff to provide patients with care. We're expanding resources within the emergency departments rapidly. I sanctioned 51 extra emergency medicine consultants last year. That's about a 40% increase in the total number. We've launched phase 2 of the Safe Staffing Framework, which increases the number of nurses, the number of healthcare assistants into the emergency departments. However, as we all know, there's no additional resource we can put into emergency departments that on its own will solve the issue of overcrowding. What we all know is that most of the solutions to the overcrowding in emergency departments lie outside the emergency departments. And that's why we're continuing to invest right across the board so that only those who really need hospital care come to the emergency department. And when they do, they get seen quickly. We've added millions of extra hours of home care support. We fully acknowledge that more is needed. The motion calls for a move to the living wage in the new tender. That is happening. We're also recognising travel. We've also added 1,000 work permits, and I'd like to see that go. And Minister Butler is leading the work on this for government. I'd like to see that, and Minister Butler would like to see that go much further. So we acknowledge that there are too many people waiting for home care packages. The funding is in place, and we're taking action to increase the workforce to be able to help those patients and their families. We're also investing at an unprecedented level in the expansion of primary care, as called for in Sláinte Care. We've over 90 new primary care teams in place over about an 18-month period, and many new specialist teams right across the country in elderly care, chronic disease management. Around 2,500 healthcare professionals have been hired into this new enhanced community care programme around the country in every one of our constituencies over the past 18 months. This year we're going to continue with that, and these teams, which are quite new, are going to further integrate into the healthcare services, integrate into GPs, integrate into the nursing home sector, integrate into the hospital sector as well. So more and more patients can be treated at home, supported at home, treated in their primary care centres, treated in their community, so they don't need to come into hospital, or if they do, they can be discharged as quickly as possible. We all know that limited access to diagnostics is one of the reasons people end up in emergency departments. But the GP Access to Diagnostics programme, which was launched in 2021, has been a huge success. This year we've allocated tens of millions of euro. It means GPs can refer their patients directly for diagnostics right around the country. And last year, over 250,000 scans were funded and happened under that programme, which is a new programme. 250,000 scans around the country are already in place. Sinn Féin are calling for more diagnostics. More is needed. What Sinn Féin is not acknowledging is that that's already happening. The motion calls for an increase in training places for clinicians. I agree. The motion fails to recognise that an increase in training places is already happening. More training places are being funded for students and indeed for clinicians who are pursuing advanced practice, NCHDs who are looking to become consultants. I've stated here previously that we need to double the number of healthcare college places in this country. They're already increasing in several areas. We need to see it go further, and Minister Harris and I are working together to that end. I've met several of the universities, the medical colleges, the healthcare colleges, the nursing colleges to see, is there an appetite for a radical expansion in courses for nursing, for midwifery, for dentistry, for pharmacy, for health and social care professionals. And the answer from every university team I've spoken to is absolutely, let's work together and let's expand these places. We do not train enough healthcare professionals in this country. Now, in spite of what is an unprecedented expansion of capacity, beds, diagnostics, workforce, community care, an unprecedented expansion. In spite of that, we all are aware that a perfect storm of COVID, flu and RSV, coupled with a growing population and an ageing population, means that too many men, women and children are not getting seen quickly enough in emergency departments. They're not getting a bed in the hospital quickly enough when they've been admitted. And indeed, they're not getting access to other healthcare services that they need quickly enough. So what are we doing? We're continuing with this expansion. This year, we are funding an additional 6,000 healthcare professionals right across the service. Hundreds of more beds are planned for this year. And building on recent developments, my department is working with the HSE on the rollout of the new hospitals, new elective hospitals, the rebuilding of the National Maternity Hospital and the finishing of the National Children's Hospital. However, as I have said previously, the current capital processes in this country, be they in the HSE or in government, tendering processes, planning processes, when you put it all together, they are not working. It takes years and years to put in place capital infrastructure, critical healthcare infrastructure that we need to put in place much quicker. So I'm working with the department, I'm working with government, I'm working with the HSE to see what actions we can take to significantly reduce the amount of time required from when a decision is taken to add beds to those beds being open and staffed and being used to treat patients. The current combination of processes between European laws and tendering laws and planning processes and internal evaluations and re-evaluations and strategic reviews and business case modelling and external validation of strategic reviews, when you put it all together, it's taking years and years to put in place critical infrastructure that patients need now. And that's something that we're looking to change. At the same time, more capacity is not the only answer. There are significant changes to working practices, and more community-based care is not the answer in and of itself. At the same time, we know that there are significantly different outcomes from different hospitals, and different community groups across this country. And we must see consistency of good practice. We have to see more hours in hospitals and in the community sector when senior decision makers are there to treat patients, admit patients, discharge patients, help bring patients home. It's what the new consultant contract is all about. We've seen over the last few weekends the enormous beneficial impact of having senior decision makers in the hospitals and in the community at the weekends. So yes, we need more capacity. We are in the middle of the biggest expansion in capacity in a very long time right across the system. At the same time, we need to implement the Sláinte Care vision of community-based healthcare, integrated healthcare, and that is happening. And as well as that, we must modernise working practices, patient flow, patient treatment, patient discharge, rostering, right across our service. And if we do all of those things, and we're in the middle of doing all those things, there's a lot more needed, but if we can continue with all of those things, what we are going to see is a well-resourced, well-staffed, well-funded, modern healthcare service that gets people right across this country the care they need when they need it. Gura Magat.